Hello and welcome to our first virtual news conference. I'm Jessica Lovell with the University of Kansas Health System. In studio is Kansas U.S. Senator Jerry Moran with a federal update. He is also joined by Dr. Steve Stites. He is the Chief Medical Officer at the University of Kansas Health System, who will provide a brief update on the novel coronavirus and risk. Also joining us is Tammy Peterman. She is the president of the Kansas City Division of the University of Kansas Health System. She will give us a briefing on health system preparations. And Dr. Alan Greiner, he is the medical officer for the Wyandotte County Unified Government Health Department. He will provide you with a public health update. And to all the reporters, you may begin sending your questions to the panel using the email address provided in the media advisory that was sent to you. And remember to include your name and your news agency with those questions. First, Senator Moran, let's start off with you. Welcome to this virtual news conference. Certainly a great opportunity to practice that social distancing, right?
It is, and I would encourage Kansans, folks in Kansas City and Missouri to follow those guidelines about social distancing and do all the things that are practical and common sense related to keeping your hands off your face and washing your hands and using hand sanitizer and not being out among people and particularly large crowds when it's not necessary. First of all, let me thank the press for joining us this morning and thank the University of Kansas Health System for the opportunity I've had to visit with the experts, some of whom are at this table this morning. I'm on my way back to Washington, D.C. For consideration of the legislation that the House of Representatives passed on Saturday. And while I was home in Kansas this weekend, I wanted to take the opportunity to learn more about what I should be doing to be of help and so that I can better serve people in my role in Washington, D.C., but also be able to be more informed to answer people's questions when they ask me what I think they should do. And again, I'm grateful for the expertise, the science and medicine that's represented at this table and at KU Health Systems. So first of all, let me say that the weekend involved mostly telephone conversations, not much personal contact, but the conversations took place with the Kansas Department of Health and Environment and about 30 Kansas Health Department, County Health Department officials from across Kansas, a conference call on Saturday. I've also visited this weekend by phone with the commanding general at Fort Riley and our commanding general of troops in South Korea. There are many Kansans deployed to South Korea, making certain, first of all, that we have something to assure loved ones here in our state and in the country that the steps have been taken in Korea to protect soldiers and their families, and to make certain that the circumstances of Fort Riley are such that our soldiers there can feel safe and secure. The steps that have been taken are significant and appropriate to try to contain any spread of the coronavirus. We've also had the opportunity to visit with the Kansas Hospital Association and other medical providers to get a feel for what's taking place in hospitals across the Kansas. And while I happen to be at the University of Kansas Health Systems today, we also want to make certain that the hospital in every community, the physician, the county health department have the information and the necessary tools to respond to any circumstances that might present themselves. I would quickly say that my takeaway this morning from the conversation, and I'll leave most of the discussion, I suppose, to the experts, but I've learned from conversations here at KU about the expense associated with this. And while the legislation that we have pending mostly deals with trying to alleviate now some of the economic problems, there will be economic problems for the healthcare delivery system in our state. And it's something that I want to pursue when I return to Washington, D.C. It seems to me, based upon what I know from today's conversation, that the testing opportunities are increasing by the day, and the experts here will talk about that, but I also want to make certain that those tests are available across Kansas, and that if in their absence we have a courier system that gets those tests. One of the things we can do in being prompt in getting results from the test is reduce the anxiety and reduce the number of hospital beds that might be occupied by someone who is waiting for the result of their test. So the number of tests that are available is important, but how long it takes to get the test read and information provided to the healthcare provider is significant as well. I'll return to Washington, D.C. with the desire to see how many ventilators, should they become necessary. There's a federal, I don't know if stockpile is the right way, storage of those ventilators. should someone need them, and I want to know how we get them to somebody in Kansas or Kansas City or Missouri that might need them if that becomes the circumstance. So ultimately the goal, it seems to me, is what we've been hearing on social media and in the news, is we need to flatten the curve so that there's not a spike in occurrences and give our healthcare delivery system across our states the opportunity to have the resources necessary to meet the needs. And that takes us right back to where I started. Do the things that we've been instructed to do in regard to large crowds and hand washing and hands on face. Those things will make a difference and will enable the folks who are seated here at the table with me the opportunity to provide the care and treatment for those who might need it in the future. Thank you.
You know, this virus is new, and to date it's infected over 130,000 people worldwide and over 3,000 in the United States. We have so much to learn. Fortunately, we've learned a lot, but there's a lot more we need to learn. We do know some key elements, though. We know that the majority of people who get infected with this virus are going to survive, by far the majority. We also know that over 80% of patients who get this virus are going to be able to stay home and never have to come into the hospital. And we know that our collective job is to do exactly what Senator Moran did, or just said. Our job is to flatten the curve. What we're afraid of in healthcare is if the rate of the rise of new cases is so great that it could overwhelm the healthcare delivery system. Well, how do we solve that? Well, we know what to do. We know that because we know how to flatten the curve. The first thing is you have to wash your hands for 20 seconds. Do a good job of it. Go look at all the videos on the internet. Go look at YouTube. You'll find the ones that show you, I got to do this for 20 seconds. I can sing to myself happy birthday twice. Whatever it takes, 20 seconds is the key. Cough into your elbow. Don't go around touching your face. For us guys, that's especially hard to do. We've been doing that for a long time. Don't be around others if you are sick. And most importantly, practice social distancing. What does that mean? It means you're going to have to stay home. It's the reason the NBA and the NCAA have canceled their games. It's the reason there's no spring training. But if we do the right things, we'll be back at those things before you know it. We also know that if you're older, you really have to make wise choices about staying at home and staying isolated from others. We also know that all of the hospitals in Kansas City and across our region are ready to take care of patients who have COVID-19. We can all do that together, and here at the University of Kansas Health System, we are ready to take care of the sickest of the sick. We have been in constant contact by phone, email, webmail, just trying to reach out to people we know across the world and across the country who are in the midst of this crisis already, to make sure that we're fully prepared to do the right thing for our patients and our folks that we take care of. And we know that if the faster we do these things, the faster we get about flattening the curve, the better off we're all going to be, and the sooner we'll be back to the Royals, the Chiefs, and church, and all those things we love to do.
As the state's only academic medical center, we are in a constant state of readiness and preparedness. We care for thousands of patients every day in our health system, some of the sickest in the region. The number one priority we have is to make sure we have a safe environment for our patients and a safe environment for our staff. And here's what we're doing to make sure that we're keeping our patients and our staff safe. We've limited access to our hospital by some of the vendors and suppliers and consultants. We've said, if you don't need to be here, we don't want you to be here. If you're needed for daily operations, you can come to our place, but we also will screen those individuals as well. We've expanded our work from home opportunities for our staff. Now that's a little hard in healthcare because we need many people right here at our health system. But for those who don't need to be here, we've given them the opportunity to work from home. Early last week, we banned travel, all business travel, nationally and internationally. We said we will not have individuals travel. We also suggested that people not travel personally as well. For those people who have traveled, we're doing some screening depending upon where they traveled. We want to make sure that only if you are safe, you're coming back to work. We've restricted visitors in our hospital. We know that that's really important as well. We've moved much of our testing to an off-site location. We know that much of the testing can be done in an area outside of our main campus. So we've done that for our patients. We think that's the best and right thing to do. We also know that we will continue to test patients who need to come to the hospital for care as well. I think a big part of being prepared is communication. Just as the media is doing every single day, we're doing that inside our organization as well. We're communicating with our staff, with our physician, with our leaders. We want them to have information. Things have changed, you all know that. Things continue to change, and our job is to make sure we're communicating with our staff, with our physicians on a very regular basis. We're also working with other hospitals in our health system across the state of Kansas. We want to make sure they have the right resources and the right information to provide the very best care to their patients as well. As Dr. Stites mentioned, we are learning from our colleagues across the country. We're talking to people from Washington and from New York and from California and other areas. Coronavirus hit their communities before it hit ours in many cases. We're learning from them as we continue on this journey. Today, the Metropolitan Healthcare Council is calling a group of hospital leaders together so that we can learn from one another right here locally. We believe that's really important. We can coordinate together. We can learn from one another. This is a time for all of us to come together. We can do a better job if we work together, and we know that we will. We are working 24/7 to make sure that we are meeting the needs of our patients and our staff. Here's what I want to say. At the end of the day, our job is to make sure we're providing the safest care to patients today and tomorrow, and to provide the safest environment for our staff, and that's what we'll do.
I want to thank the University of Kansas Health System and Senator Moran for having me here today to represent the unified government of Wyandotte County, Kansas City, Kansas, and our public health department there. The hospital that we're sitting in here also sits in Wyandotte County, so I wanted to give you an update on some of the things that we're doing at the local level, as well as some of the most recent statistics we have. Our goal at the Unified Government Health Department Public Health is really to promote partnership and promote best practices. We do have more and more information every day on this condition. We also want to provide as much information and to communicate that information in the most effective ways, even if that means doing things that we haven't traditionally done to get the word out to our citizens. We want to share what's going on with our investigations on a regular basis, and we want to be completely transparent about that. As many people know, we've had one positive case in our county and the only fatality in the state of Kansas here in Wyandotte County. We've been conducting a vigorous contact investigation since that case came to light on Thursday. We've received some good news in the last 24 hours in that 85 individuals, both staff and patients at the care center where the individual that's deceased came from were all negative, so all 85 of those tests were negative. We still have an additional 25 tests that are pending at the state health department lab. We're also having a number of new sites coming online with private testing, so through different labs. My understanding that there's at least 4 private labs that are now offering tests in the region. Our health system here, as Dr. Stites and Ms. Peterman mentioned, is now doing that at much higher numbers as well, which we think is going to allow us to control this in a much more effective manner. We have 20 individuals in this county under 14-day quarantine at sort of different day levels in that, and we're monitoring them on an ongoing basis, and we plan to continue that through the local health department. Again, the big message we want to get out is the same one that's been mentioned multiple times. We want folks to avoid crowds. The CDC in the last 24 hours has stated that they feel crowds of any more than 50 individuals could be higher risk, so we want to encourage people to stay home and stay where you're only around a small number of people that you know are not ill. Social distancing less than 6 feet, of course, is important too. We want people to wash their hands or use hand sanitizer on a frequent basis, not touch their face, cough into their elbow, all these things we've talked about. If more information is needed, we have a local resource at wykokck.org/COVID-19. And then our state, the Kansas Department of Health and Environment, has a 24-hour hotline that's open to the public as well as healthcare professionals. That number is 866-534-3463 or 866-534-3463.
All right, thank you all for that. We have about 15 minutes for questions, so I want to jump in and try to get to as many as we possibly can. And Dr. Greiner, I'm just going to go back to you. A question has come in from John Hanna. He's with the Associated Press, and he wants to know, should we be shutting schools down? That's a big question for a lot of people.
That's a very big question. In our state, we had some guidance from our governor last night that we should at least have schools closed for this week. That was highly recommended, and I believe that's been enacted across most of the state. But as we get more information, we still have to sort out how long those closures need to go for. We want to allow administrators, teachers, staff to get prepared. We think this week will really help that. We're also, again, as we learn more every single day in the states where schools have been closed, I think we'll learn more about the value of that. We know there are trade-offs. These are going to be agonizing decisions for school districts. Kids will have problems with receiving enough food. We've heard a lot about that, as well as lots of child care issues for the parents, especially those parents who might be engaged in healthcare professions. So tough decisions, but we've got a little guidance, and I'm sure there'll be more to come this week.
All right, Senator, did you go ahead?
In regard to this issue of food, it's one of the topics that I raised, or was raised in our hearing last week in Washington, D.C. with the Secretary of Agriculture, and USDA has made their feeding programs available to students that are low income receiving a school lunch. Now is in the process of being a system to deliver those meals or a pickup for those meals. So the school lunch program will continue for low-income students, even though there may not be school. And that's a positive development as we try to meet the nutrition needs of Kansans across the state.
All right, and Senator Moran, why is South Korea testing cases at a much faster rate than the United States? That's a question from Brian Lowry. He's with the Kansas City Star.
Brian, thank you. It is one of the conversations that I had with the commanding general, General Abrams, on Saturday. And I think the numbers are 1 out of every 280 people in Korea have been tested. And so, I mean, the message there was that the concentration of people are such that it's more compatible with more tests, but the tests were available, and Korea responded in a way that got people tested quickly. And so it's a role model that we ought to be looking at. It's one of the takeaways from my conversation Saturday. Why were they capable of additional number of tests, more people being tested than what we initially in the United States were able to do? The testing issue seems to me to be one that Kansans are most interested in. I'm sure if you have any symptoms you want to test, we need to make certain that the symptoms are such that you should have a test. And the idea that is being developed here in Kansas City is a drive-through test. And what the good news is to me on the testing is that more testing kits are becoming available more places. And perhaps as important is that the test results today with the arrival of what I learned here at the University of Kansas Hospital System, that the test can be now done locally, and the turnaround time will be more quickly than sending the test to Topeka. So I think the testing situation is improving, and I'm anxious to see what it is that South Korea determined to do early on that we should replicate.
Senator, I think one of the key things is that because we haven't had a lot of tests, the CDC's response to that is so dead on right, and we have to have people follow it. Social distancing is the answer. When you don't have the information, you just stay at home as if you're quarantining yourself in order to stay safe. That can blunt the curve, because South Korea didn't really restrict movement because they had a lot of tests. We have to restrict that movement, and people have to help us do that.
All right, Tammy, I have a question for you. This is from Margaret Allen. She's with the Daily News, and she had a question about Hayes Med. How many ICU beds are there at Hayes Med? How many ventilators? How are we making sure they're set up to go?
Okay, I don't think I can give you the exact number of beds in the ICU at Hayes, but I can tell you we're working daily with each one of our health systems across the state that are part of the University of Kansas Health System. We're making sure that they do have the resources they need. We're also working with them to develop some telehealth opportunities for provider to provider. We know that that's very important. Sometimes you need expertise that might not be available locally, so we're trying to make that available. At this point in time, we have, as we've communicated pretty regularly, even last night with some of our health hospitals across our health system, we know that they are doing very well. They are staffed well. They have leaders on the ground helping address any issues that they might have. And anytime they have a question, they know they can pick up the phone and call our team, any number of the members of our team on a regular basis. Dr. Stites is working with the medical staff. We are all working with the leadership, and we're addressing issues as they come up in hospitals across the state.
All right, Dr. Stites, Larry Pierce has a question. He's from My Town Media out of Chinook, Kansas. Does soap need to be antibacterial to be effective?
You know, soap is effective because it's soap. It doesn't. Yes, it should be antibacterial for a lot of different reasons, not just for the virus. But if it's truly soap, you're going to be fine because it's the process that occurs to membranes that soap breaks down that allows it to be effective and safe. I've heard somebody say, well, soap has to have 60% alcohol. That's not true. Hand sanitizer needs to be over 60% alcohol, but the reality is soap works because it's soap, and I think that's the key thing. Alan, any other thoughts for you?
No, I think it's the proteins that surround the DNA or RNA of a virus that get broken down by the soap itself, and so get that stuff on for 20 minutes.
20 seconds.
20 seconds, sorry, thank you. 20 seconds.
Still seems to be available in the stores, I think.
Yeah, that's right.
Unlike hand sanitizer.
Yes.
So soap is the key.
That's right. We could call it soapification, but I don't know if that's really a word.
All right, Dr. Stites, another question for you. This is from Chad Fry. He's the managing editor out of Newton, Kansas, with the Kansan. You had mentioned flattening the curve earlier, preventing local and rural hospitals from getting overrun if a significant amount of people get sick all at once. How do you prepare and handle that?
How do we prepare to flatten the curve, or how do we prepare to handle the folks?
Well,
I'll answer both.
Please do.
The flatten the curve is all about the same things you've heard us describe and emphasize over and over again. Social distancing, more than 6 feet away, stay in your home, don't go out. And then what do you do if you can't flatten the curve? And the answer to that is you have to work together as a state and a region. Because if one place is overwhelmed, other places got to help with that patient population. We can't look at this as saying, we're only one hospital. We have to look at it as a health system across the state, both for the University of Kansas health system, but also we're all in this together. That's what's happening up in Seattle. You know, one hospital got full. They didn't start asking whose patients they were. They worked together. Remember, every hospital is capable of taking care of COVID-19 patients. These are not patients who need some kind of bizarre new technology. What they really need is support, and then they need mechanical ventilators to help them breathe. That's a standard of care that all of us should be able to reach. And then if folks get too sick for that, you know what? We're right here to help.
There's a backup system, too. It's a federal issue involving the Department of Veterans Affairs. And the Department of Veterans Affairs is, by law, beginning in 1982, charged with being a fail-safe system. That's probably not the right words, but a backup to the public health system, to hospitals across the country. So if the capacity is met in that setting, the VA has beds and equipment and personnel to respond as well. So the VA, I have a conference call this afternoon with the Secretary of the Department of Veterans Affairs to have an update on their efforts to make sure that if they are needed, the VA is a place that can help meet the needs of hospitals and community clinics across the country. So another aspect.
Senator Moran, question from Steve Dunning from Channel 9 News here in Kansas City. Will you vote for the COVID-19 relief bill that the House passed last week?
Well, I am returning to Washington, D.C. to take a look and potentially vote in favor of it. That's my guess is the answer to that question is yes, but I want to make certain I understand fully what it entails. So likely yes, I will vote in favor of it. The other aspect of that is that there may be, and I anticipate there will be, additional legislation that follows on. And as I mentioned in my opening remarks, one of the places that we need to put resources, in addition to trying to care for people who are unable to go to work, who are caring for somebody in their home, who have children at home because school's not in, to try to take care of the financial circumstances of every American in who's impacted by this, we also need to make certain that the resources are available to our healthcare providers. And I will be looking for other opportunities. If this bill does get amended, perhaps this is the vehicle by which we can do that. But there are other things we need to do in addition to what has been agreed to in the legislation that is now pending before the United States Senate. It's expected that the vote will take place early this week. which suggests to me that it's probably going to be a circumstance in which most members of the Senate come together and decide to vote in favor of it, knowing, however, that there are significant additions. And I would indicate, if there's to your small business readers or listeners, the paid leave aspect of this bill, I think, is very onerous for those small businesses, and we need to figure out a different way of meeting the needs of laid-off workers than what this bill provides. We'll see if there's an opportunity to make that better or different, but we have our work cut out for us even when this bill passes.
Also, another question. This is from Mary with the Wyandotte Daily. Mary Rupert says, has any link been found at this time between the nursing home in KCK and nursing homes owned by the same chain in the state of Washington?
I can address that. There's been no link. As of now, we're still conducting that intensive connection investigation, and we don't know how that patient was exposed to the virus at all. Because all 85 of the staff and residents in that facility have now tested negative, we're looking further for contacts, but we don't have any reason to believe there's a connection with the Washington facility.
All right, John Hanna has a question. This just came out. A lot of reporters have been asking this. The CDC guidance now is that public gatherings of 50 people or more be canceled for 8 weeks. Should Kansas follow suit and ban gatherings of that size? Some of the states are closing gyms, bars, movie theaters, closing restaurants. What are your thoughts on that?
I had a bit of conversation with Dr. Stites about this morning, so I'd leave it to the experts.
You know, here's the deal. Whether the state of Kansas cancels them or not, the socially responsible thing is to not go to large gatherings. Some people would say the number is 4 to 6 and not 50. The smaller, the safer. And I think we just need to follow that. Don't wait on the government to tell you to do it. Go ahead and try to make sure that you're not in large gatherings. That is the socially responsible thing to do. That's what flattens the curve. That's what keeps people out of the hospital. And that's to help us return to health as fast as possible, Alan.
Doctor, I intruded on your answer.
No, I mentioned the number 50, but I agree with Dr. Stites. I think we're going to see, as more evidence comes out, that number may shift lower. This is one of those situations where we've all got to work together as a community, as a state, as a nation, to impact this and save lives. This is really about saving lives. And so doing the right thing is really important, and I think if we work together, we can accomplish that.
Sacrifice now, we'll be better off faster, sooner.
Can I just get one last question in, because I want to give you all some final thoughts. This is also from Margaret Allen with the Daily News. Any consideration for field treatment locations on college campuses or elsewhere, as urged by Governor Cuomo in New York?
So I know that in Wyandotte County, we have not had any planning around that yet, although we've begun to explore some more deep partnerships here with the University of Kansas Medical Center. We already have what's called an academic public health affiliation agreement. In fact, we have a meeting later this afternoon on that affiliation agreement, and we may do what some other states have done, where we enlist the help of student learners and the health professionals, especially those that are more advanced and may have the skill set to be able to help in places like remote settings or outlying community clinics. There's a lot of clinics we partner with here at the University of Kansas Health System that can really make an impact if we're all working together. And that may require volunteers, but again, if we're coming together as a community, this is the time to do that, because we really can make a difference.
Ms. Allen asked me a question on Saturday, 2 of them in fact, and because she's asking some of them again, we must have not gotten her an answer. One, I would highlight again the number of ventilators. One of my missions today is to find out how somebody in Kansas, a hospital, a healthcare provider, could access ventilators that are stored for times of emergency in Washington, D.C. And so when you ask about haze, if they're needed, we want to make sure that they're available. And secondly, Ms. Allen asked me, how many hospital beds are there in Kansas? And I didn't know the answer, and I still don't know the answer, and I don't know that any of you could tell me, but we'll get an answer to that question as well.
I think that question about numbers of beds, we also have to address the fact that every hospital has a surge plan to make sure that we can take care of the patients who need to be cared for in the acute care setting, whether that's critical care or acute care.
All right, we need to wrap up. Last quick final thoughts, Senator Moran, on what you want the public to do.
Thank you to the folks who are covering our conference and the effort to get the experts in front of Kansans so that they can make the decisions based upon the best medicine, the best science, and thanks to the University of Kansas health system for their tremendous effort in making certain that we are prepared for what may come.
All right. Well, thank you, Senator, and our entire panel for being here, and thank you all for joining us. That concludes our news conference.